Good afternoon. The launch of the health insurance marketplace is right around the corner, and we're so glad that you've joined us today for our webinar on working together to expand your outreach and enrollment efforts. I have a couple of reminders before we get started. If you are viewing as a group, please go to the chat window and type in the name of the person registered and the total number of additional individuals in the room. For example, Tammy Jones +3. This will help us with our final attendance count. This presentation may be downloaded now. Please visit sbhforall.org/webinars to download the presentation if you would like it in hard copy. All attendees are in listen-only mode. If you have a question at any point during the presentation, go ahead and type it into your chat tool that appears on the bottom right corner of your control panel. You will also receive an evaluation survey directly after the webinar. Please let us know how we are doing and topics that you would like for us to cover in the future. This webinar is being recorded and will be archived on our website within the next 2 days. You may access the archived webinar and PowerPoint slides under SBHC Operations within a few days by visiting sbhforall/webinars. We expect that by the end of this webinar, you will be able to inform participants about current federal opportunities to be engaged in outreach and enrollment, identify key timelines for the launch of the health insurance marketplace, and inform participants about key safety net partners in outreach and enrollment efforts. Today we will be joined by 3 guest panelists. Our first guest panelist, Donna Cohen-Ross, will be talking about the National Connecting Kids to Coverage campaign, an initiative to boost Medicaid and CHIP participation rates and reduce the number of uninsured children. Donna is a senior policy advisor in the CMS Center for Medicaid and CHIP Services, to which she brings over 30 years of experience in improving access to public benefits for children and families. In her current position, Donna plays a principal role in the implementation of the outreach and enrollment provisions of Children's Health Insurance Reauthorization Act and is a leader in the effort to streamline enrollment for eligible individuals into Medicaid under the Affordable Care Act. Donna spearheads the National Connecting Kids to Coverage campaign and also advises states on securing CHIPRA performance bonuses and has designed and manages state and community-based outreach grant programs. Our next guest panelist, Kristin Romanov, will be providing an overview on outreach and enrollment. Kristin is Deputy Director at Health Outreach Partners, where she oversees all training and technical assistance services for community health organizations across the country, serving vulnerable and underserved populations. She joined HOP as a project manager in July 2004, providing program evaluation, program consultation, and training to health outreach programs. She holds a master's in public health with a focus on health behavior and health education from the University of North Carolina at Chapel Hill. Her public health experience includes skills in program development, implementation, evaluation, community organizing, and community development and health promotion and education. And our last guest panelist, Jeanette Payton, will give a brief overview on public housing and identify key ways safety net providers can work together. Jeanette is currently the Health Promotion Project Manager at North American Management. As a certified health education specialist, she has an eclectic background which blends sociology, criminal justice, and public health. Her background allows her to embrace the World Health Organization's definition of health. She has the opportunity to conduct research for various federal, state, and local organizations, including the U.S. Department of Justice and the Commonwealth of Virginia, while working as a researcher at the George Washington University. And without further delay, I'll turn it over to our first presenter, Donna.
Thank you so much, Sarah, and thank you for having me today on this webinar. I'm very excited about it because I hope that we're going to dig deep into what I think is one of the most important things we can be doing right now, outreach and enrollment activities to get children enrolled in health coverage, and very soon other members of the family. So I'm just really pleased to be here with everyone today. Sarah is going to, I want to just let everyone know that Sarah is going to be advancing my slides. I'm very grateful for that help. And so you'll hear me say, next slide, please. Thank you. So I wanted to start us off by grounding us in some of the numbers. And at CMS, we have been working with and relying on data from the Urban Institute since we began our Connecting Kids to Coverage campaign in 2009. And I'm going to talk a lot more about the campaign, but first I want to tell you a little bit about the numbers. And the main takeaway from this slide is that over time, we have been moving in the right direction when it comes to getting children health coverage. Eligible children getting covered through Medicaid and CHIP, we have really advanced the ball. The rate of uninsured children in 2008, when we began looking at this data, was about 8.9%. It dropped to 6.6% in 2012. 1.7 million children gained coverage through Medicaid and CHIP, and actually those data are from the CDC. The number eligible but not enrolled dropped from a little bit under 5 million, about 5 million in 2009 to 4.3 million in 2011. And here's a really important point. During that time, as you know, the country was experiencing an economic downturn. So during this period of time, 3 million more children became eligible because of the economy. And even though we were, in effect, swimming upstream, we still saw this great progress in terms of the decline in the number of eligible children who were not enrolled in Medicaid and CHIP. At the same time that some of these indicators were going down, an important indicator was going up, and that is participation in Medicaid and CHIP, and by that we mean the percentage of eligible children who are actually enrolled. So in 2008, we were just shy of 82%. Eligible children enrolled in the program, and over time you can see that we have continued to improve. We also have these data on a state-by-state basis, and we have them on our insurekidsnow.gov website, and you're going to be hearing me talk a lot about that as I go through these the presentation. So you can see where your state stands by looking at that website. But one point that I wanted to make is that we have a growing number of states that are over 90% participation, and we've achieved that because of policy changes that states have made, but also because of effective outreach and enrollment. And I just want to let folks know that later this week we are expecting the latest iteration of these data to be made public, and I won't be letting anything slip by telling you that we are still on the right path, and we're very excited about that. So Sarah, I think we can go to the next slide. For this audience, I probably don't have to spend too much time on just grounding us in what Medicaid and CHIP are. They're health insurance coverage programs for children in low and moderate income families. Just as a point of reference, children in a family of 4 earning up to 200% of the federal poverty line, which is $47,100 a year for a family of 4 or more. I'm going to come back to that in a minute, may qualify. The reason I say or more is because, of course, many of you know that depending on family size, the income might be different, but also 200% of poverty is what most states cover, but there are a number of states, a growing number of states that are covering children with incomes at 250% of poverty, 300% of poverty. So one thing to always keep in mind is that when we're talking to families, they may not realize that their children are eligible based on their income. They may think they have too much income. They may think because they're working their children aren't eligible. But most often, and in most states, families will be surprised that they can have the income that they do and their children still be eligible. And of course, these programs offer comprehensive health services, and I've given you an idea of what some of those are on this slide. And I would just point out that what we know from some of the research that we've done is that the dental care is extremely important to families, and so we always try to include that as well. If we go to the next slide, we can see that one of the things that we always try to keep in mind, and we keep this in mind as we do outreach and enrollment and as we reflect back on what we do. We've done some research. The findings are on the Insure Kids Now website. There's a link on this slide for you. It was a national survey that we conducted of families with children eligible for Medicaid and CHIP who were enrolled, families with eligible children who are not enrolled, and then families whose kids were eligible but who had private coverage. And we talked to parents throughout the country. We learned that families really do value Medicaid and CHIP. 82% of parents with uninsured eligible children say they would be interested in enrolling their children, and the number is even higher if the child had been enrolled in the past or the family had some experience with the program. 93% of parents with a child enrolled say they're very satisfied or very satisfied with the coverage that their children get. And the range of service and the quality of care, according to parents, ranks very high. And this is really important. When you're doing outreach, you want to have something that you feel very confident and very proud of sharing with people, and we think that Medicaid and CHIP fall right into this category. Let's move on. We also always look at data on what Medicaid and CHIP mean for families with respect to helping their children stay healthy. And as you can see, as compared to children who are uninsured, children with Medicaid and CHIP coverage are more likely to have seen a doctor in the past year and to have a regular source of care. They're more likely to have gotten preventive care that all children need. They miss fewer school days, and this is a really important piece as well. Let's move on. There we go. Coming soon, very, very soon. Many of you may be in the same situation as we are, but we have a daily count out, and we are 20 days out before October 1, which is the open enrollment, the beginning of the open enrollment period for the new coverage that's available. We are going to see a simplified, data-driven system for consumers. It will mean no wrong door. Whichever way uninsured individuals and families come to the system, they will be able to apply. They'll be able to apply using a single streamlined application. The application is online, and that's the way we hope most people will apply, but they can also apply in person, by mail, by phone. There will be less paperwork involved, a quicker process, and also very important, simpler renewals. Those of you who have been doing outreach and enrollment work know that it's just important to keep an eligible person in the program as it is to get them enrolled in the first place. Let's move on. I want to talk a little bit about the Connecting Kids to Coverage Challenge. That is the outreach and enrollment program that we have been engaged in for the last 4 years, in which we have been focused on getting every single one of those eligible but unenrolled children into Medicaid and CHIP. Our goal is that no child who's eligible is and uninsured is not enrolled in health coverage, and so we're really focused on boosting that participation rate and reducing the number of uninsured children. You can see our goals right here. I want to pay a little bit of attention to that last one. Enrolling eligible parents helps get eligible kids covered. that is a really important piece for us right now, because even though our campaign has been focused on children, we know that when we get an eligible parent enrolled, it's more likely that the children will get enrolled as well. We know that from a whole body of research, and we know that we have parents who are eligible but not enrolled in Medicaid, but we also know now that the new health coverage opportunities are opportunities for the whole family. So we think we are going to see lots more children get into the program because their families as a whole are focused on getting health coverage, and we're very excited about that. Let's go to the next slide. I want to say a little bit more about the campaign itself. It is a campaign that is led nationally here at the Center for Medicaid and CHIP Services. We provide the leadership and the resources, but we have partners all across the country. They are organizations that we've been working with for many years. Some of them you'll hear more about as we go forward. We have grantees through our Connecting Kids to Coverage outreach and enrollment grants. I'm going to say something about them in just a moment. We focus on waves of activities when families are thinking about children's health care needs. So we have a wave of activity during cold and flu season in the winter, asthma and allergy season in the spring, and then back to school, which we are in right now, and that is usually our most productive time. As you'll see in a moment, we have activities, we have special materials focused on each of these waves of activities. I want to say a little something about our grantees. Through CHIPRA, the Children's Health Insurance Program Reauthorization Act, and then later on the Affordable Care Act, we were fortunate to have grant money that could go to organizations around the country focused on enrolling eligible children. Right now, in our third round of grants, we have recently allocated $32 million to 41 grantees. Many of them are school-based health programs. Alameda County Social Services Agency in California is one. Covering Kids and Families of Indiana is another. The Kaleida Health Program in Buffalo, New York. Many, many others are focusing attention on school-based health programs and community health centers as well. We have a whole focus area that works specifically on outreach in schools. We provide materials and other resources for all, not just our grantees, and I hope that if you haven't had a chance to participate in our webinars and use the materials, that after this presentation you will be looking for those things. Let's move on. I want to give you a little taste of what our materials look like. Our messages have come straight from our research. So for example, one of the things we know parents tell us is that with Medicaid and CHIP, they really have that peace of mind of knowing that their children can get care when they're sick and injured, that they can get the preventive care that all children need. From that, our theme became Medicaid and CHIP is an extra hand for parents with their hands full. And of course, we had great time looking for images of children who were just being mischievous the way children are, and you'll see in a moment what we came up with. In addition to posters and flyers, we also have radio and television public service announcements. And if we go to the next slide, I think, Sarah, we can take a look at this PSA. Hopefully this is going to work.
Parents sure have their hands full, and they could use an extra hand. Now, every state offers free or low-cost health insurance for your sports hero or budding artist. Kids up to age 19 can get checkups, doctor and dentist visits, hospital care, prescriptions, and more. Your child may qualify based on your family size and income. It's one less thing to worry about. Call or go online for more information.
Terrific. Thank you, Sarah. It was a little bit choppy on the screen here. You can find the PSA in English and Spanish. All our materials are in English and Spanish. The print materials are in several other languages as well. We can customize the print materials for you. We do have several versions of the public service announcements depending on states in our target markets, which I can talk more about. But we have been making the public service announcements available far and wide. So if you're interested, please let us know that you would like the public service announcement. We're encouraging folks to post it on their website, run it in their clinics, and use it in other ways that help get the word out. And again, we can talk more about that. Let's move on for a moment. I want to show you our back-to-school materials. You can see what they look like. If you live in Fresno, California, or Albany, New York, a number of other places, you will have seen these two kids on billboards and buses and throughout our outdoor advertising in specific target markets. We have these items as posters and flyers. Again, we can customize them for you. I've shared the public service announcement. I also want to mention that we have a new partnership with Scholastic. They have created an electronic magazine all about back-to-school efforts to enroll eligible children in Medicaid and CHIP. There's a link to our materials. We worked with the Academy of Pediatrics on this, so there's a lot of links to the AAP website as well. This went out about a month ago to 100,000 school administrators and school nurses throughout the country, but we're also making this available for you to share it in your school districts and in organizations that you work with, and you can find this on our website, and we are really encouraging folks to share it. In October, we'll have a second version of the electronic magazine that focuses on open enrollment and what's available for the whole family. On our website, we also have a series of back-to-school boosters, which were weekly outreach tips that went out to our listserv, which is now up to about 9,000 participants. We hope that you'll sign up as well. It was about targeting efforts using school lunch program data, engaging community businesses and community organizations in outreach, focusing on teens, because we know we have a much harder time getting eligible teens enrolled. We also, on our website, have strategy guides. For example, we have one called the Game Plan, which grew out of our coaches campaign a couple of years ago, where we engaged school-based sports programs, community-based sports programs, in all kinds of activities around getting school athletes to sign up for coverage. As you know, in order to play sports in school, kids need to have a physical exam. In some places, they also need to have insurance. We want that insurance to be comprehensive. We want it to work for kids, not just when they're on the field, but when they're off the field and throughout the year. So we hope those resources will be of help to you as well. Again, in so many ways, if we go to the next slide, in so many ways, your program, school-based health clinics and other community health center programs and community-based programs can do so much, can play such a critical role in helping get children enrolled in coverage. I know we're going to hear more about that from the other speakers, but you provide leadership in the school environment when it comes to health. You have an opportunity to provide direct application assistance, which we think from our experience tells us that there is no replacing that. We can do all kinds of marketing, but if we don't direct people to someone who can help them with an application, and we do think it's going to be much, much easier going forward, but still there will be families who need help. They need help from people they trust in a place they trust, and very often that is their child's school. So we're really hoping that many of you will become certified application counselors, will work in other ways to help direct families to application assistance. I just want to mention at the very end here, again, that renewal is just as critical as initial enrollment. We want an eligible child to stay covered for as long as he or she is eligible. If we go to the next slide, which I think might be the last one, you can see that we have links to the materials on the InsureKidsNow.gov website. You'll see a special back to school page there. We have an outreach video library, which I really hope you'll take a look at. We have not all of them are focused on school-based outreach, but many of them are. We have one from California that shows how Alameda County has been working with school-based health clinics. We have one from Miami, Florida that shows in a really fun video how the University of Miami Medical School teamed up with Miami-Dade Public Schools to help enroll kids in health insurance. Families got their kids covered, but medical students learned a lot more about the patients from the community who had uninsured children and needed that coverage. And we think it was not just a learning experience for everyone, but really a very enriching experience with respect to improving access to care. You can see how to subscribe to our updates. Again, we have weekly outreach tips. You'll get webinar announcements. We have several of them coming up, and you'll get links to other training and materials. And we really do hope that you'll take advantage of all of this. Thank you for your time, and I am very eager to hear from our other speakers and answer questions for you later. Thank you.
Hi there, my name is Kristin Romanov. I'm Deputy Director at Health Outreach Partners. Thank you, Sarah, for your introduction earlier. I do want to tell you a little bit about our organization. Health Outreach Partners is one of the national cooperative agreements that HRSA supports specifically to support community health centers, those serving general underserved communities, as well as those serving underserved populations like migrant and seasonal farm workers and individuals experiencing homelessness and people residing in public housing. We know that a lot of the health centers are school-based health centers, so we really appreciate the opportunity to speak to you folks about how we provide training and technical assistance around eligibility outreach, around outreach and enrollment stuff with the exciting developments that are now coming forward. We really focus on helping organizations build strong and sustainable grassroots health models with the ultimate aim of improving the life of vulnerable and underserved populations in our communities. And we work very closely with health centers serving special populations and also community-based organizations that partner with health centers, like Head Start programs and migrant and seasonal Head Start programs. We often have legal services organizations involved in our trainings with health centers and other health and social service agencies. We define outreach very broadly. Health Outreach Partners starts with the premise that outreach generally begins by going into the community and connecting with individuals in your communities. But once there, it's not just education and marketing. There's an aspect of facilitating access to healthcare and social services, whether that be helping someone schedule an appointment, providing information about the hours of operation and days of service. But it can also include things like providing health education and doing case management in the field, making sure that the care that you provide and the information that you provide really is responsive to the linguistic and cultural needs of your community, and helping people really become equal partners in their health care, sort of understanding not only how to go and get care, but how to participate in that care. And the last aspect of outreach that we like to talk about is increasing the community's awareness of the presence of underserved populations. So with that as a framework for understanding how our organization thinks about outreach, I want to briefly touch on the National Outreach Guidelines for Underserved Populations that we developed. We actually had developed many years ago, when we were a national cooperative agreement focused just on health centers serving migrant and seasonal farm workers, we had developed a set of outreach guidelines for farm worker serving programs. but we have since really expanded our focus to working with health centers serving all underserved populations. And in 2012, we decided there was a real opportunity to update those guidelines and make them much more broadly relevant. But we wanted to really tap into the experience and expertise of others on the ground who work with additional populations. So we collaborated with 4 other national cooperative agreements, and we also involved an advisory panel of representatives from community health centers and other health and social service agencies, really wanting to get the perspective of folks on the ground to help develop a set of guidelines that would provide direction for how to most effectively use outreach to help increase access to care and utilization of care in people's communities. And we developed 10 broad guidelines, which you can see here. They're divided into 3 categories: person-focused guidelines, community-focused guidelines, and one guideline that's really focused on outreach program planning and evaluation. And within each of those 10 broad guidelines, we listed several suggested strategies for how you might do, for example, health education or outreach-centered case management, or in the case of the last person-focused guideline, eligibility assistance. So we really do see, given the presence of outreach workers in your communities, their ability to develop relationships, their ability to develop trust with the most vulnerable people in your communities, we really see outreach workers as folks who can do a great job of helping do this outreach and enrollment work. So our 6th guideline was that the outreach program will assist members of underserved populations to enroll and maintain participation in health and social service safety net programs. And this certainly can be expanded beyond the public health insurance benefits like Medicaid and CHIP to helping people get connected to programs on the exchanges if they don't qualify for Medicaid or CHIP. In 2011, we actually developed an issue paper for the Kaiser Commission on Medicaid and the Uninsured. This was, the Kaiser Commission on Medicaid and the Uninsured wanted to look at specifically how can you identify and assist eligible but uninsured immigrant families in getting covered. And at the time they were looking at getting covered under public benefits programs, but again this can apply to helping eligible but uninsured immigrant families get covered under plans on the exchanges. This report, if you're interested, is on our website, but it's entitled Connecting Eligible Immigrant Families to Health Coverage and Care, Key Lessons Learned from Outreach and Enrollment Workers. And in order to develop this, we did focus groups with outreach and enrollment workers in California, Florida, and Washington, D.C. We did a total of 4 focus groups in those 3 states. And we developed a report that highlighted the lessons of the outreach workers, the barriers that their families face, the strategies that work best with them. This slide shows you some of the barriers that really came out. And the barriers, we tried to really highlight the ones that were specific to immigrant populations because lots of things came out that would be hard for anybody, like burdensome and confusing application processes. And to some extent, access to technology can be something that is challenging not just for immigrant families, but for others. But fear was a big one, especially in undocumented and mixed status families. So if you have parents who are undocumented, but children who are born in the United States, the parents are often very reluctant to apply on behalf of their kids because they're scared. Or even families who everyone has a green card, but they're worried that they wouldn't be able to become a citizen at some point in the future because they would be considered as a public charge if they received this benefit. So we learned that that was a big fear for folks. Difficulty meeting documentation requirements. Can they get all the paperwork together that is needed even if they are eligible? Language and literacy issues were really big. Can someone actually help them in their language? So these were all barriers that came up, especially for eligible but uninsured immigrant families. And what the community health workers told us is that there are a number of general strategies that really work well with these families. And Donna highlighted a little bit of some of these, but really those one-on-one personal relationships came up over and over again. Building trust, providing one-on-one assistance, and more specific strategies also came out of our interviews. Things like providing forms that they can use to declare if they have no income or only cash income. That was often the case with farm worker families, if they were getting paid in cash, or other folks who are just getting paid in cash. How can you represent that accurately? So helping people come up with forms. Also coming up with a list of documents that could be used instead of what's listed on the application form. So what alternative documents might they be able to use? Maintaining contact throughout the process was very important, and cards that you could give to folks to request translation assistance when they presented at a place where they were trying to get help with getting signed up for health insurance programs was also a really powerful general strategy. Now, Donna touched on some of these too, but we also liked to look at some, this was outside of our project with eligible but uninsured immigrant families, but this is something that fed into a curriculum for outreach workers that I'll tell you about in a minute. But we also are really interested at looking at some of the effective school-based strategies. And what's exciting for those of you on the call who are currently in school-based health centers, these things can work really well just directly in your school programs. But we also provide a lot of information to health centers that are not based in a school, how they can work effectively with schools. So there's a section in our curriculum about developing formal or informal collaborations that could definitely be useful for schools and health centers trying to work with each other. But within the school setting itself, communicating with parents, providing information and assistance at school events, working with school liaisons. There are all kinds of things you can do, and you want to make sure that the information you're providing always refers people back to what they can do next. So if you have certified application counselors within your system, make sure that anyone who can communicate about the fact that people might be eligible for affordable health insurance have those basic messages in place and then know exactly who to refer them to within your school system or elsewhere in your community to actually get help getting signed up for an application. A couple of other strategies, and this was one that Donna touched on, so I won't go into it, but building partnerships with athletic departments can be really powerful in some schools. Working with school lunch programs can be really powerful in some schools, especially not only just sending home information to kids who qualify for these programs, but considering a process to automatically qualify those kids for Medicaid and CHIP programs. Health Outreach Partners provides, our training and technical assistance is provided in a variety of ways. We have a website, which I'll show you on the very last slide, but we do lots of intensive one-on-one training with individual health centers and community programs. We also do lots of regional trainings through conferences or other regional events where we might be invited to train a variety of people from lots of different organizations. We developed a really intensive training of trainers curriculum on affordable health insurance outreach, and that's really aimed at helping community health workers and outreach workers from health centers and other organizations to not only develop their skills for doing outreach, but also how to teach others in their communities and in their organizations to do it. We do a lot of facilitated planning with organizations, so how could I really get all of these ideas into a really structured plan and make it happen? We host lots of what we call our peer-to-peer webinars, where we invite folks from organizations on the ground who are doing interesting work to share their experiences. And we collect innovative outreach practices from programs across the country. So we really try to learn not just specific to outreach and enrollment, but broadly, what are folks doing in their communities that really work with outreach. this is the cover of our Training of Trainers curriculum. The full training, if we were to come out and do it in your organization or for a regional training that might bring a lot of organizations together, the full training is about 1.5 to 2 days long. It's very experiential, it's very skills-based, and it really focuses on drawing out from participants the best messages and strategies that will work in their specific communities. This is our website. It's www.outreachpartners.org, and a lot of the things that I referenced today can be found on this website. If you are interested in talking to us about getting some training or support, you can contact us directly through the website, or you can contact me, and my email address is on the very first slide. And this concludes my presentation.
Great, thank you. Thank you, Sarah, for such a great introduction earlier. As Sarah mentioned, my name is Jeanette Payton. I am the Health Promotion Project Manager with North American Management. And I just wanted to briefly give you guys an agenda of what I will be discussing. I will give you guys an overview of public housing residents and their demographics. I will also discuss how to identify new niches for safety net providers. I'll discuss ways that PHPCs and other safety net providers can work together. I'll emphasize the importance of having case management and navigation, and then I'll discuss training opportunities. But before we begin, I just wanted to take a quick audience poll, and the question is, how well can you describe the challenges safety net providers face when serving special populations? And you'll have about 30 seconds to respond to this.
I'll close the poll in 10 seconds.
Great. It looks like at least about 14 to 20% of you can explain it at least very well. But hopefully by the end of this presentation, those numbers will change. So just quickly to talk about public housing residents and their demographics. The main takeaways that I would like you to have from these slides is that residents of public housing are predominantly white and of non-Hispanic ethnicity. Their average annual income is a little bit less than $14,000. The majority of the residents are from single female-led households, and over 50% of residents have less than a high school diploma. Now, this will be very important later when I talk about potential methods of outreach, because knowing that the materials that you create are at the appropriate reading level is very important. Again, this is just basic demographic information, and I did want to point out that 38% of residents of public housing are children. And then also I just wanted to show you this slide that shows the different sources of medical insurance for those who have had services at public housing primary care centers. And as you can see, a little over 50% have regular Medicaid, but 33% are uninsured. This opens up a great segue to how to identify new niches. Before I go into that section, we will have another audience poll. This second question is, how well are you able to list methods of outreach when serving special populations? And again, you have about 30 seconds to respond to this.
I'll close the poll in 10 seconds.
Okay, well, these numbers are a bit higher grades. And again, by the end of this presentation, hopefully you guys will be able to identify more methods of outreach when serving special populations. So to give you a bit more information about PHPCs, they are very patient-centric, and they provide public housing residents with access to affordable, high-quality, and cost-effective health care. These health center programs offer comprehensive care, which includes primary and preventive care, dental, mental health, substance abuse treatment, and pharmacy services, as well as enabling services. PHPCs are located on-site at public housing developments or locations nearby, which helps to increase the accessibility, and it also reduces barriers such as transportation. PHPCs are open to all community residents regardless of insurance status, which further helps to reduce access to health care barriers. What makes PHPCs special and different from a typical doctor's office is that PHPCs are able to tailor their services to fit the unique needs and priorities of the public housing and other nearby communities that they serve. Next, I just wanted to discuss some of the key health issues that patients that are served by public housing primary care centers face. This includes high blood pressure, diabetes, oral health, and mental health. And as I talk about these, a lot of these are chronic diseases that open up great ways to have partnerships and collaborate with other organizations. One of the most effective ways that PHPCs are able to achieve their success is through collaboration. PHPCs collaborate with other community organizations such as churches, schools, and public housing authorities. Some also offer mobile units to bring programs and services into the community. With the help of resident leaders and community health workers, PHPCs are able to reach out to some of the most isolated members in their community. Here I'm just giving you a brief overview of ideas or ways to plan outreach. I won't discuss everything on this slide, but one of the most important things is assessing community needs and resources, and also assessing agency needs and resources as well. So when you're planning this, when it comes to evaluation, with your community characteristics, it's very important to know who your target population is, and also what are their unmet needs. This is very important because there are many times that people want to offer services or products of what they think the community needs, but until you actually meet with the community, you talk to some of the residents and the members, that's the best way for you to make sure that whatever you're offering can help to serve everyone in that population. The community resources are also critical because if you assess that, you can determine what are the strengths within the community. Again, that opens up doors to collaboration. And also, what are some of the challenges? Next, I will discuss key ways that safety net providers can work together. As we all know, HHS granted awards to community health centers to help enroll uninsured Americans. This map shows a listing of PHPCs who received those grants. As implementation of the Affordable Care Act moves forward, PHPCs will play a significant role. PHPCs represent an ideal model of care because services range from prenatal care to chronic disease prevention to treatment of diseases, as well as health education and much more. On this slide, I show a table of the PHPCs who received this grant funding. And with PHPCs being a part of the safety net, they are designed to treat the whole patient through culturally competent, accessible, and integrated care. With the release of these grant funds and resources, PHPCs are equipped to keep residents up to date on the ACA, help residents enroll in the marketplace, or help them apply for Medicaid and Medicare. Now, as we talk about this grant funding that they've received and how they work with other community organizations, health center programs do face some challenges. One of the biggest ones is financial obstacles, which again is a great reason to partner with other organizations. School-based programs for immigrant children or minorities can also help to attract parents who may need these services also. Cultural competence is also a big issue, along with low insurance and benefits enrollment. Ways, again, that you can overcome that is by offering the enrollment there at the health centers, and also they can host activities at housing facilities. Offering things such as food and fun are a great way to talk about topics that could potentially be uncomfortable, such as mental health. And also partnering with faith-based organizations is a great way to overcome some of the medical mistrust. This is just a brief intro to ways to develop an outreach plan and how to implement the outreach plan. The community support strategy is very important. Identifying community leaders. If you have residents, parents who frequently use your services, they can be a great testament to the community and let everyone know the services that you provide and that it's okay to actually receive these services. Also, community health workers. They have people that come out and talk to them. They may have experienced the same health problems that they may have, and so it's great to have someone who looks like you, talks like you, to explain this information to you. Also partnering with the housing authorities and partnering with other community organizations such as social service organizations, partnering again with the faith-based organizations, other healthcare providers is a great way to make sure the word, you can get out the right words. And addressing opposition promptly, because there is that medical mistrust in some of these communities. If you discuss it with the people head on and you make sure they understand the goals and objectives, that's a great way to overcome that opposition. I just provide a few samples of outreach methods such as door-to-door. That's a great way to get out to the community. If you have members of your healthcare organization or your community organization out door-to-door, introducing yourselves, making sure that the community members actually see your faces, that's a great thing. Also with community events. Community events, if you have a booth, if you have flyers to hand out, or if you give free screening such as high blood pressure, again, that's a great way to reach out into these particular special populations. And I just briefly wanted to talk about the importance of having case management and navigation. For these populations, they have particular barriers to health care and healthy living. Education and health literacy, along with economic hardship and unemployment. And with some of these populations, they have poor food options, they have limited access to health care, they may live in unsafe neighborhoods, they may have structural hazards in their buildings, there may be mold or mildew, and they may have insect or rodent problems. And what this does is it can affect their respiratory health, it can cause allergies and asthma, it can also cause mental disorders, and it also can contribute to chronic diseases. So again, having someone there who understands, a case manager or a navigator who understands the health of the whole person and how all of these factors contribute to their health or their continuing to use medication as prescribed, that's very important to make sure you are enabling that they are as healthy as possible. Training opportunities, again with CMS, they have official training resources, and I've included a hyperlink there, and they also have official resources, which I've included. With North American Management, we offer webinars, monographs, provider and resident-centered fact sheets. And with the resident fact sheets, we try to make sure that they are low literacy and that they are at least about 6th grade level or lower. And with the training manuals, I have an example of a training manual here, and it's assessing the healthcare needs of residents of public housing. We also have newsletters. We have resident-centered newsletters. We have an annual training symposium that's open to public housing residents. It's open to housing authorities. It's open to PHPCs as well as other community health centers, and basically anyone who's interested in the health of public housing and low-income residents. We also offer one-on-one training assistance, and that's open to anyone. All of this is free. We make sure that if someone needs help, they're not sure how to design an appropriate outreach plan, we assist them with that. And I just wanted to lastly show you our contact information. Again, we are the National Center for Health and Public Housing, care of North American Management. I have included our website information and also our Twitter information. We encourage you to follow us on Twitter. We tweet lots of information, including when we post new resources to the website, such as fact sheets. We have a couple of PowerPoint presentations that we've created related to the Affordable Care Act. We've also created a brochure. And here is my email information. And I just wanted to close with resources that I've included for you that you can peruse at your leisure. I've included information on how the Affordable Care Act can potentially affect low-income families, cultural health resources, and I've also included a YouTube video that North American Management created for the National Association of Community Health Centers. And this just gives you an overview of PHPCs and how they help to improve the community. And then I included a few case studies of some of the PHPCs that we have and ways that they were able to overcome some of the health issues that their community was facing by working with organizations. Thank you.
Okay, great. Thank you so much, Donna, Kristin, and Jeanette. And at this time, I would like to open up the floor for questions. So if you have a question, please go ahead and type your question into the chat box located on your control panel. So we've been getting a couple questions about if the slides will be available, and they are already up on our website right now. So if you would like to download a hard copy, it is on our website at sbhforall.org/webinars. Donna, Jeanette, or Kristin, did you all have any questions for each other?
No, I don't. This is Kristin.
Okay, great.
This is Donna. Just wanted to say thank you again, and hope everyone on the webinar takes a look at the materials, ours, and also the other speakers. It looks like a great wealth of information. So I really appreciate being part of this.
Yes, thank you again. So at this time, it appears that we do not have any questions from our attendees. So if you all have questions later on in the future, please go ahead and email them to us at programs@sbhforall.org, and we will answer them accordingly. I have a couple of reminders. For more information and resources, visit our webinar page at sbhforall.org/webinars to access our archived webinars featuring outreach and enrollment strategies. Our Promising Outreach and Enrollment Strategies and Toolkit webinar highlights the Colorado Association of School-Based Health Centers Toolkit, focusing on school-based health center outreach and enrollment in Medicaid and the Children's Health Insurance Program. The toolkit is also located underneath the webinar as a hyperlink. Our Biggest Bang for Your Community Health Bucks webinar features a full-service, ready-to-use curriculum on how to train and utilize community health workers in your clinic, and how you might employ one in partnership with an AmeriCorps program. In addition, our Community Health Worker Reference Center that can be found on the webpage within the Special Initiatives section features an overview of the potential roles a community health worker can hold in your SBHC, HRSA's most recent Community Health Worker Toolbox, and much more. And in conclusion, this presentation has been recorded and will be archived on our website within 2 days. To request support and technical assistance related to outreach and enrollment issues, please send us an email at programs@sbhforall.org. Please take a moment to fill out the survey listed on the bottom of this page. Your feedback is vital in helping us to craft presentations and tools that will best serve you. In addition, the survey will also be directly emailed out to you after our webinar today. Again, thank you for joining us, and have a great day.